Here in Norristown, ACLAOM, a community service organization, provides low-income Latinos and immigrants access to resources and programs. 41% of lawfully present immigrants have low income and work in industries with no employer-sponsored coverage. Because of this, immigrants are uninsured and avoid necessary treatments.
Alamo is also the safe haven for a lot of communities that are coming new to the county and are considered new in the country too. So people come here for different services. We have a community health connections program. Under that, we have community health workers who provide services to people with chronic diseases to make sure that they follow up with their appointments, that we support them through the process of their illnesses and making sure that they're connected with specialists in their medical care. So we're part of the medical care with the doctors, making sure that they are following appointments, that they don't utilize the emergency rooms. Instead, we help them to take care of their medical needs before it gets to that point. We also provide health literacy, which means that we have different opportunities for people to learn, get informed, and educated about different health issues.
We have a brief conversation about cancer in general, the risk factors, some kind of symptoms, the prevention test that they could do, also the guidelines for the screening test. And we talk about breast, cervical, and colon cancer.
Along with cancer, there are other risk factors limiting immigrants' access to healthcare. Language barriers, deportation fears, access to technology, and of course, healthcare literacy. Like cancer, diabetes is also a health problem Latinos face. 16% of Latino immigrants stated it as being their biggest health problem for them and their families.
Cases where people come and said, I have this, I have diabetes or I have cancer, right? So those people may need more long-term care than others may not know. So they may be here with us for 1, 2, 3 years, depending on the needs. So it doesn't really have a set in stone. We never want to turn away people who may need us longer. So we try to make sure that we serve them. We have, like, for example, seniors in our senior program. They come once a month. They get their food that they want. They come for the food demonstration, their vegetables. They're happy, and we don't see them. We also have our benefits acquisition program, where people who needs to apply for health insurance or any other health-related applications, they can come and they can meet with our benefits acquisition specialist, and she will help them to apply for health insurance, making sure not only to apply but follow up with the application and making sure that they get approved and that they get the services they need. So our program is very comprehensive to make sure that we meet people where they are. I think, like any other nonprofit, we sometimes are always concerned about whether if we're gonna get the next grant, right, to keep our services, and that's where I think our board has been very crucial to make sure that we always applying for grants, that we always making sure that we follow up with whatever our funder requested of us when they gave us the money, but also to show our impact in the community. So it's not only go and get the money, but it's how we maintain it and how we measure the impact that we have in the community.
Numbers that we track shows the amount of people that are having access to care, having the screening they need. Sometimes, especially with the ladies, we have biopsies We also have surgeries and cancer treatment through our program. So we know that it's making a difference. Also, we can recommend them to participate in the MORIVIVI group, which is the Latino cancer survivor group, and they could receive information and the support they need.